Hello everybody and welcome to the Tuesday edition of Video Clips, and I'll start with a couple of announcements. On Monday, January 27th at 9 p.m. is our next Introduction to Plant-Based Nutrition. It's our 90-minute Power Pack Teach You How to Do It session. You don't want to miss it if you haven't participated in it. And then on January 28th, we're having a new thing. It's called Ask the Expert Panel. And Dr. Lana Contos is going to interview three of our great members and health professionals, Dr. Marielle von Lanthen, who is a pediatric gastroenterologist, Sabrina Seitz, who is a master herbalist, and Ellen Siegel, who has written a book called Be Happy No Matter What. So we'll cover all kinds of things, mental health and some remedies for winter colds and pediatric gastroenterology and a diet and lifestyle approach to that and other health issues. So don't miss it. It's an opportunity then for you also to ask questions of these really incredible people. So I picked out a couple topics I want to talk about today, and we're going to start with the fact that I think doctors have become a little bit cavalier about taking out people's body parts. I mean, the first time people started having trouble with gallbladder because they eat a high-fat diet, oh, just take it out. You don't need it anyway. The same thing is true more and more, much to my chagrin, about prophylactic removal of the breasts. Find out that you're genetically predisposed to develop breast cancer. Instead of talking to people about how to avoid it with diet and lifestyle, we just remove their breasts. And it has always been an issue that we do way too many hysterectomies in this country, and it's not slowing down. We're too quick to take out the uterus and ovaries. Hundreds of thousands of women get hysterectomies every year. About 10% of those surgeries are justified, and the rest of them are not. Younger women are forced into early menopause, and many years often of taking hormone replacement therapy. And older women are basically told that their ovaries are useless, and if they're not going to have any more children, then hysterectomy doesn't make any difference, and that's really not true. I don't think the side effects of organ removal are adequately discussed with patients, and one side effect that there's considerable amount of evidence that I think should be discussed, particularly with younger women who are being told to consider hysterectomy, is the risk of cognitive decline. A new meta-analysis looked at the relationship between hysterectomy and younger women in both cognitive decline and Alzheimer's disease. The study concluded that the earlier the age at which a woman has a hysterectomy, the faster cognitive decline takes place, particularly in the areas of episodic and semantic memory. And also, the younger at age of hysterectomy, the greater the risk of developing Alzheimer's disease. Two longitudinal studies with 1,884 women were reviewed, and all of the women in the study had no evidence of dementia at the time that the study began. A third of the women underwent surgical menopause during the follow-up period, which was between 1994 and 2012. Tests were administered to measure various types of their memory. And the researchers reported that women who underwent surgical menopause were younger at menopause and more likely to take hormone replacement therapy, 71% of them for an average length of 13 years, as compared with women who experienced menopause naturally. And there are risks with HRT. The researchers also reported that the earlier the age at surgery, the more quickly the decline in cognitive function. Each year earlier was associated with 6 months worth of cognitive aging. That's pretty significant. The researchers were able to access brain autopsies for 600 women and found that earlier age for hysterectomy was associated with plaques associated with Alzheimer's disease. Cognitive decline was reduced a little bit by taking hormone replacement therapy, but there was no protective effect between hormone replacement and the plaques associated with Alzheimer's disease. And cognitive decline and Alzheimer's disease were not observed correspondingly in the women who did not have a hysterectomy. So it was a clear dividing line. Hysterectomy increased the risk. The researchers were really clear that this shouldn't be interpreted that HRT is protective for cognitive decline because while there was a slight difference in the women who took hormone replacement therapy, there are serious risks, as the researchers pointed out, that should be considered before making the decision to take it. An interesting aspect of this study was that it included women who had all types of hysterectomies, some of them ovaries only, some of them uterus only, they kept their ovaries. Other studies had established that removal of the ovaries was related to cognitive decline, but this study showed that taking the uterus out had an equally devastating effect. So I guess I'll just sum it up by saying that I'm not opposed to hysterectomy in principle for people who need it. or organ removal of any type. There are definitely situations in which it's warranted. But we're doing it way too often, and these types of side effects are not being really discussed thoroughly with patients so that they can make an intelligent decision about whether or not to have an organ removed. I think that prior to organ removal, every effort should be made to change diet and lifestyle, and it should be the last resort. And we've actually had many members over the years who, for example, were scheduled for gallbladder surgery, changed their diet, and called and canceled the gallbladder surgery because they didn't need it after a few weeks on a whole foods, low-fat diet. The issue went away. Of course, those people have immediate pain when they start eating a lot of fat, so as long as they're compliant, they don't experience pain and they can keep their gallbladder. I think that's so much better than being so quick to approach people with the surgeon's knife. All right, so I'm going to shift gears to another topic right now, which is overweight and obesity in teenagers, which is just, it's so distressing to me. Dietary fat is the major cause, and the study I'm going to talk about actually looked at dietary fat and abdominal obesity and fat in teens. And the study basically showed that regardless of how much exercise they get, regardless of the total calorie intake, dietary fat is the biggest predictor of abdominal fat in teenagers. This study included 224 kids whose abdominal fat was measured along with their diet and exercise habits. And the teens were divided into 3 groups, a high fat, a moderate fat, and a low fat diet. By the way, the low fat diet wasn't actually so low fat, but we'll put that aside for a minute because it was still kind of interesting. The researchers found that more dietary fat led to more abdominal fat and more total body fat. Now, this is important because while all excess body fat contributes to an increased risk of disease, the best thing is not to have excess body fat. Abdominal fat really increases the risk of conditions like heart disease and diabetes even more. The researchers wrote, these results point to dietary fat content as a key risk factor in abdominal adiposity in adolescents, no matter how much physical activity they do. What was more interesting to me even than that was the fact that the relationship wasn't between abdominal fat and saturated fat, but rather polyunsaturated and monounsaturated fat and abdominal obesity. Now, that doesn't mean that saturated fat is safe to consume. I'm not implying that. We all know the effect of saturated fat on blood vessel health, cardiovascular disease, etc. But the issue here is that all fat is bad fat when you eat too much of it, and that includes mono and polyunsaturated fat. We still have a lot of health professionals out there who are telling people the issue isn't how much fat, it's the type of fat, and it's just not true. You can get in just as much trouble eating a lot of poly and monounsaturated fat as you can saturated fat. This also doesn't mean that exercise isn't important. It is, but you can't exercise away some of the damage you do with a high-fat diet. I mean, I've looked at food journals for kids, for example, who are consuming 650 calories at lunchtime at the age of 6. What's this kid supposed to do? Jump on a treadmill every 3 hours for an hour? I mean, you cannot exercise away this level of excess calorie and fat consumption. So the way to better health is a combination of the right diet, which includes keeping that fat consumption really, really low, and exercise. And of course, this issue starts in childhood. We used to talk about weight problems principally in adults, but unfortunately, increasingly, the discussions are about kids these days. All right, so that's all for today. I'll be back to you again on Thursday. And as usual, please feel free to pass this on to anybody who you think might enjoy watching it.